We'll start our agenda with the first great presentation on clinical signs and symptoms of urticaria and angioedema, as well as different types of it. So, Özge, the stage is yours, and thank you for joining us today.
And thank you very much. Hello and welcome to the 7th UCARE for You patient webinar. I'm Özge Sevil Karstarl. I'm a dermatologist at the UCARE Center of Reference and Excellence in Turkey. Today, I will talk about clinical signs and symptoms of urticaria and angioedema and the differential types. Urticaria is characterized by itchy red bumps, which we call wheals. A wheal has three typical features. Its sharply circumscribed superficial swelling of variable size and shape. It's extremely itchy and they are short-lived. Individual lesions disappear in less than 24 hours. Angioedema. What's angioedema? It's often present with deep skin color swelling, usually affect lips, eyelids, hands or feet. Patient may complain burning, tightness and pain rather than itch. Its duration longer than wheals and can take up 72 hours. Urticaria is very common, affecting approximately 20% of general population, and in 40% of patients, wheals are accompanied by angioedema. Urticaria is classified based on its duration as acute or chronic and the role of definite triggers as inducible or spontaneous. Let's first talk about acute urticaria. It's defined as the occurrence of wheals and angioedema less than for 6 weeks. In most cases, it's resolved within a few days. Infections and medications are the most common causes of acute urticaria. Unfortunately, the underlying cause is not always clear. However, since it is self-limiting, it usually doesn't require a diagnostic workup apart from patient history for possible triggering factors. If symptoms develop shortly after consuming a specific food, testing for food allergy may consider. It's very important in all kinds of urticaria to avoid it if the trigger is defined. What about chronic spontaneous urticaria? It's defined presence of wheals and or angioedema for more than 6 weeks. Various factors like infections, medications, mostly painkillers, and emotional stress can trigger or exacerbate symptoms, but they are not the cause of spontaneous urticaria. The course of the disease is unpredictable and you may not have a lesion when you go to the examination. Therefore, please take photo of your lesions. The history you gave your physician is very important in diagnosis. Please monitor the duration of lesions individually and inform your physician if it exceeds for 24 hours. Some basic tests are recommended to determine the disease course. Our patients often ask about the necessity of allergy tests, but chronic urticaria is almost never of allergic origin. I think it will be useful for you to know that the inducible urticarias we will talk about now also accompany with chronic spontaneous urticaria. So what's chronic inducible urticaria? It's not a rare condition and represents 30% of chronic urticaria and characterized by recurrent itchy wheals, angioedema or both. These symptoms are triggered only by exposure to specific physical or environmental stimuli. In inducible urticaria, wheals appear within minutes after exposure to the trigger, and they are short-lived, except the late pressure urticaria. Let me stress that for all types of urticaria, your history is the most important part of diagnosis. Based on your history, we diagnose inducible urticaria using a provocation test specific to the suspected subtype. Let's take a closer look at inducible urticaria. First, symptomatic demographism. It's the most common type of chronic inducible urticaria, presenting with itching and or burning skin sensation along with wheals following scratching, rubbing or scrubbing. Diagnosis can be verified by simple provocation tests, scrubbing with a wooden spatula, or special instruments such as dermographometers like prick test. And the other common type of inducible urticaria is cold urticaria. It's the second common type of physical urticaria and Weil's angioedema induced by skin contact with cold objects, liquids, or air. I want to emphasize 2 points here. First, it's important to determine the temperature level, the threshold that triggers the symptoms. And secondly, don't forget, except extensive cold exposure can lead to severe systemic symptoms. Again, we can do simple provocation tests, for example, with an ice cube in a plastic bag, or we can use special provocation tests like temp tests, and they can also help us to determine the threshold value. And the other type is cholinergic urticaria. It's characterized by tiny wheals that appear after activities that rise your body temperature, such as exercising, sweating, or hot baths. Lesions typically vanish within half an hour. Moderate exercise using a stationary bike or treadmill is often used as provocation test. And the other type is delayed pressure urticaria. It's characterized by swelling in pressure area, approximately 6 hours after exposure to pressure, such as wearing tight clothes, or standing or walking for a long time, or carrying a heavy bag. Here, patients feel pain rather than itch. Unlike the other forms of chronic urticaria, symptoms resolve over a long period of time. Other rare subtypes of inducible urticaria can be triggered by sunlight, localized heat, water, regardless of its temperature or vibration. As a summary, the most important part of diagnosing urticaria is a detailed history. For that, we need help of our patient. Please photograph your lesions. Follow how long each lesion lasts, and if you notice a specific trigger, please share it with us. Thank you for your participation and attention.
Thank you, Özge, very, very much for sharing your expertise today with us. And I just want to summarize briefly for the patients, right? So when we are, as a patients, preparing for the doctor's appointment, so we should definitely bring our pictures with us, correct?
Yes,
are there
right.
any... Yes, perfect. So then, is there anything else very important other than pictures or
Maybe
I don't know,
diary.
maybe diary? Yes.
Yes.
What type of diary should we run?
To share how often your wheels occur or how long they last.
That's a very, very great tip for the patients to have. And some of them, especially the patients who are suffering from chronic spontaneous urticaria, they are desperately trying to actually find a trigger, right? So what should the patients even look for the trigger, and should they come with a preparation on the most important triggers if they do not notice any induction sites? Do they have to present you their medical history, maybe prior diseases, maybe some operations, medication plan? Is that also important?
Yes, you are absolutely right. The triggers is infections, medications, sometimes but rare, especially in adults' food. It's very rare. They have maybe if they share them with us, we can help them and avoid them. And also, don't forget, inducible urticarias may accompany with spontaneous urticaria. So another triggering factor like environmental or physical may exacerbate your symptoms. So following it will help us.
Very good to know. Good, we'll definitely keep that in mind. And just to clarify, so some patients tend to get a little bit confusion, right? So urticaria, known as hives, and then they suddenly develop angioedema, and they are then confused. Okay, so I do have wheals, but I don't have angioedema. Do I still have urticaria? Or if I do only have angioedema but no wheals, do I still have urticaria? And what if I have no itch? Is it still urticaria even if I develop wheals or angioedema? How is it actually?
Yes, it's really complicated, but it's possible. You can only have wheals or you can only have angioedema. But it's important to know that if angioedema starts at childhood and if you have a family history, maybe it will be hereditary angioedema. So you have to share it with your physician. But in general, they can be separate and occur only wells or angioedema. So don't worry and just share it with us. We can help you. And if there is more complicated situation like hereditary angioedemas, you will have many symptoms different and they will lead us.
Perfect. Thank you very much. And you have mentioned very important point that the wheel should at least be up to 24 hours there. So we should actually follow the individual lifetime of one wheel. What should we think about and what do we look out for if the wheel is lasting longer than 24 hours?
Yes, it must be keep in mind that urticaria vasculitis may mimic the urticaria, spontaneous urticaria. So it's important to different them with a biopsy and further testing for systemic symptoms. I think the most important side is differentiate from urticarial vasculitis.
Perfect. Thank you very much. And the last question for this round from our patients is regarding the stress. And stress is a very important impacting factor on the development of urticaria. Would you consider the stress, acute stress, high anxiety as a trigger, first of all, for acute urticaria that may lead to the development then later on the chronic spontaneous urticaria? Do you see stress as a possible trigger for urticaria to appear?
Yes, definitely. Emotional stress is an important triggering factor for also acute and chronic spontaneous urticaria. And commonly we see in patients not just a triggering factor, but also urticaria causes emotional stress. So they are not separate entities.
Yeah, sometimes that, the vicious circle where the stress induces urticaria, but then you're stressed because of urticaria, and then it's, constantly like that. But good, we have a few more questions, which we'll be covering later on in our discussion part. So thank you for now, and then I would like Carolina to take over the stage and tell us a little bit more about the comorbidities in urticaria, and then we'll delve into questions regarding this. Thank you.